So prospective parents can better understand prenatal screening results if they have a firm pre-test understanding. So if a GP is able to sit down with them and explain the process and what the potential outcomes will be and what those outcomes could possibly lead to, I find that most of them will have a much better understanding of what comes out through the results, and they know which questions typically to ask next, and they understand the things that they don't understand in that scenario. So really, I think it comes down to the pre-explanation of the prenatal screening options that makes such a difference. So results for these prospective parents can be incredibly varied, and prior to undergoing any type of screening, they should have a good understanding of what the results may mean. So for example, different tests, different screening methods will come up with different accuracies and will mean more. And in almost every scenario, the only way you're going to know things for certain is if you go to diagnostic testing. But often prenatal options and prenatal screening isn't described in that way. And so sometimes patients will get an information and think that's the answer. And they'll start to make decisions based on something that isn't as accurate or even final.
When anybody is contemplating a pregnancy, we actually don't know what it's going to be like to be a parent, then when you've had a child, what it's going to be like to have another child. I mean, these things are all part of a future person and a future you, and you don't really know those sort of things. So when you're faced with screening, all of a sudden it seems to be a bigger, and it's a big dilemma, I suppose, and people perhaps have never had a chance to think about where they sit with the ideas of probability and what likelihood is about. And those sort of aspects around screening are important for people to be aware of, and I think it becomes a community thing, so you don't have to make a decision within a 5 or 10 minute medical consultation. It's not diagnostic at that point. So in terms of probability, that you'll often be given results that need to be interpreted, to be understood in terms of what likelihood there is for a particular outcome. And certainly the people providing the results can help with that. But it might also be helpful to get advice from other people about, all right, well, what happens next? And because some of those tests that come next can have a risk with the baby being miscarrying. And so being aware of what those potential outcomes are is really important. And again, a family has the right to say no, don't want to go any further.
I think the key is to work together. I would imagine sometimes a healthcare provider sharing prenatal screening results or news or even just information about that feels a great weight of responsibility to be the font of all knowledge, but there are always going to be limits to what one particular person can be or share with another. And so I think it's important that healthcare providers are aware of the range of different possible supports for families, aware of where they can further their own education in a space that perhaps they don't spend much time. And I think it's about having a united, consistent, non-directive, non-emotive approach to this. I think sometimes in that state of shock and awkwardness or discomfort with the news that they might be discussing with a family, it's very easy for our personal biases and things to come to the forefront in moments of stress. That's human nature. But I think if we just can all learn to pause and not be afraid to say to a family, I can imagine that this is really huge news that you're hearing from me right now, and I don't necessarily have all the answers right away that you might be wanting to hear about, but rest assured I will connect you with people who do, or let's have a look on this site, or let's have a look at this resource together, and let's make some time again in a day or two and revisit this conversation and when you've had some more time to process it.
We offer what we call non-directive pregnancy counselling. And what that is that balanced support to be able to help them with information and to guide them through their decision making. That's something that I don't think a lot of healthcare professionals in mainstream medical models will offer or even understand what it is.
Different results that can come to light during the prenatal screening process. It all depends on the modality in which things are tested. So almost everybody in the prenatal process will have an ultrasound. That ultrasound is looking at physical findings. So it's never a firm answer about chromosomes. You'll need to follow that up with additional information. But based on the ultrasound findings and potential blood findings, we can generate an adjustment of risk chance. It's not an answer. And that can then guide your next steps. In some cases, people prefer to go straight for the newer blood test, non-invasive prenatal screening. And that blood test has a higher accuracy, but again, it's screening. It's not an answer. So you can have differing information. You can have a prenatal blood test, the NIPS, which suggests high risk for a chromosome condition, and an ultrasound that's perfect. And you need to understand how to put those together and which one has higher accuracy so that you can go to the next steps. And the bottom line is understanding from the beginning that if I want to know for sure what a result is, I need to go to diagnostic testing. The screening is not going to give me that.